Right. Assalamualaikum and a very good afternoon. Welcome to everyone. Dr. Rahmat has shared the link to the attendance form for today. So before you start, if everybody present could log in your particulars to the forms, that is much appreciated. Thank you very much.
Assalamualaikum, selamat tengah hari. Do we have participants from USU, from Universitas Sumatera Utara here?
A lot of them are still trying to log in, Prof. Dia tengah mencuba.
Oh, okay. We can allow up to 300 kan? For this
I
Zoom?
think so, yeah.
Okay. Sebab I try contact the presenter ni, dia dah blue tick tapi dia tak jawab.
I see a few names from USU already logged in, but I cannot find the presenter. Sekejap lah.
Assalamualaikum.
Waalaikumsalam.
Sorry, Dr. Suhainizam. Miscommunication with Miss Eti.
Okay, so Dr. Ika dah masuk dah ya?
Ya.
Okay, great. In that case, saya rasa kita boleh start lah. Alright.
Okay.
Okay, Assalamualaikum. A very good afternoon. Welcome to everybody to our to the Department of Community Health CME session. Today we are very honored to have our colleagues from Universitas Sumatera Utara who will also be participating in today's CME session. Thank you very much for agreeing to be part of this program today, and hopefully this will open up the avenue for future collaborations between our institutions. Okay, so let me start. Saya mula dengan menjual 3 rangkap pantun. Okay. Hari Sabtu ke Bukit Tinggi, singgah Sabanta di Kota Baso. Ibu dan Pak dosen nan ambo hormati, salamek siang jo salamek basuo. Batang durian banyak binalu, buah nan masak jatuh dahulu. Acara seminar nan ditunggu-tunggu, ikolah masanya mencalian ilmu. Dan last sekali, kuciang mengajar beruang angso. Angso tabang ke kuciang menyambar. Untuk Pak dosen jo kawan lainnya, izinkan ambo membuka acara. Okay, so today we are very fortunate to have our colleagues from USU and also from our side in the Community Health Department. We'll be sharing about a topic that is closely related to the pandemic that we are having today of COVID-19. So we have a speaker from University Sumatera Utara, Dr. Eka Lestari Mahyuni, and also one of our DRPH candidates, Dr. Jacinta Mary, who will be talking about number 1, community engagement in the prevention of COVID-19 infection in Sumatra. And after that, Dr. Jacinta will be talking about the impact of COVID-19 pandemic on mental health in Malaysia. So we'll start with Dr. Ika. Dr. Eka Lestari Mahyuni, she is a lecturer in the Faculty of Public Health, Universitas Sumatera Utara, and she started teaching there since 2005 until today. She teaches subjects about ergonomics, worker nutrition, agriculture, health work, industrial psychology, hospital occupational safety and health, the impact of work environment such as pesticides use, physical hazard and chemistry hazard. And her areas of interest in research include welding worker, pesticide use, hospital-acquired infections, and all about design and microergonomics. Okay, with concentration related to occupational safety and health, ergonomics, and pesticide toxicity. So today, Dr. Ika will be talking about community engagement in the prevention of COVID-19 infection in Sumatra. As we all know, if we empower the community, they would have greater awareness on what are the things that they need to do to prevent the spread of COVID-19 amongst the community members. So it is good that we can share the measures and the initiatives that has been done in Sumatra towards this aim. So Dr. Ika, whenever you're ready, the floor is yours.
Okay, thank you, Dr. Suhainizam. Assalamualaikum warahmatullahi wabarakatuh. I'll be grateful to come here to talk with you and share about community engagement, of course. Saya hormati ya ketua jabatan daripada community ini, Bapak ketua jabatan Profesor Madya Dr. Rosliza and Manaf, dan juga pensyarah-syarah jabatan dan pelajar-pelajar di jabatan community medicine ini. Okay, give me the time to share my screen. Okay, you can see my screen?
Ya, boleh.
Okay. Yeah. We start about today is talking about community engagement in the prevention of COVID-19. Yeah. And in the session, I will talk about three parts. And the first is about COVID-19 trend condition, community engagement, and community engagement determinant. This is about community engagement. And we know today we make it in relation with the pandemic COVID-19 trend condition. And the first, I want you to know about the condition in Indonesia is different in here. And the difference is from 1 year that we have passed the COVID-19, we have the different name source of variant from COVID-19 that we WHO divided into from 2000 and 2000, yeah. Whereas the Alpha, Beta, Gamma, and Delta are the WHO variants of concern. All of these variants were first detected in countries that have weak control over the spread of COVID-19, like Indonesia, or maybe namely in UK, South Africa, Brazil, and India. The variant that dominates positive cases in Indonesia is Delta variant, yeah, where the tag was found in Jakarta and Palembang. Its nature is easily contagious and make it quickly spread to 16 provinces, thus overwhelming the health system in Indonesia. The spreading is getting out of control, so the potential for mutation will eventually give the new variants that are detrimental to society. Until in December 2020, a new variant Lambda had been found in Peru. The spread of this virus, of course, it will bring the mutation that is known by conducting genome sequencing, with an increase in test sample from 200,000 to 400,000 sample per day, and the government has established 12 laboratories under the auspices of this research. And then the rules has regarding testing in Indonesia. Actually, it's adequate, but their implementation is not optimal. The number of the testing is limited in here. Tracing still weak and quarantine is still weak. So there is always a gap between the rules and implementation. So I think to prevent the creation of new variants of virus, potentially it's more virulent variants, it's spread in the community by restricting movement and complying with all health protocol. In addition, self-isolation is not only carried out by residents who come from abroad or infected with COVID. Then I know you have known about the typical progression of COVID-19, because this is about how the spreading and progression COVID in the body, and you are the medicine, of course, very known about and experienced about this. And the spreading and progression in here make the data or the number of cases and COVID in the world is increasing in significant. Confirmed today from August 2021, that is confirmed cases in 203 trillion, with death in 4 billion. So our death rate is 2.1%. And in Asia Tenggara, we have found that in 39 and 489 billion, and that in 599 billion. So the death rate is in 1 and 5%. It means the global risk is very high with 204 infected country and 151 local transmission country. So it means COVID is not a joke, yeah? So we have to care how to prevent the COVID-19 in our country. And this is the data where we can see from WHO region until August 2021 that America still has the high number that confirmed of COVID. And in Indonesia, you can see the data in here. There is from May until July is very increasing the cases of COVID-19, and hospitals are being overwhelmed by a surge in COVID-19 case and a depletion of oxygen supplies. So the number of funerals with the COVID protocol increased in 10 times in the May and July period. This condition going to be very well because many people die while undergoing self-isolation at home. Most are looking for health facility and waiting in line to get emergency care in the last 1 month. So the waiting time is make some people in here going to die. And this is a tip of the iceberg and must be anticipated by strengthened health facility and health human resource, of course. So there must also be strict and on mobility to prevent the increase in the rate of cases at risk of death. Many hospitals are forced to send patients home because they cannot provide the oxygen. So we are eliminating very less of oxygen. So self-isolation appeal to increasing, encouraged by directing the public to buy such equipment or recognize the symptom at the first aid. In here, because the increasing is very significant, so the bed occupation rate for isolation room and critical patient always reach 100%. And some hospitals set up emergency tents to treat patients who are still going up. In fact, many doctors are in self-isolation, unable to practice, and even die due to exposure to COVID. So in here, you can see the province that's very high in Sumatra is at the first, and in Sumatra Selatan and Aceh. Although in this session, I will giving the information especially for Sumatra Utara later. Yeah. And we know at 13 July 2021, Indonesia getting the #1 in the world with the death case. So it is very ironic and very need to care, very need to prevent and do something action if to decrease the COVID-19 cases number. So what is the solution? Maybe in here, we, back to the topic, we talk about the community engagement, of course, about the prevention of COVID-19 in Sumatra. Based on the data, the community in Sumatra is very unique. If you know, Sumatra is one island in here and so many provinces in here. Sumatra Island is the island consists in 10 provinces, 34 cities, and 110 regencies. However, for our study this time, we will focus more on condition of the community in preventing COVID infection in North Sumatra, especially in Medan City. If you know about the North Sumatra, it is located in here, yeah, with Danau Toba is the famous place in here. And North Sumatra is at the cross of position of West Pacific Trench. Yeah, of West Pacific Trench. And then, sorry. North Sumatra is rich with a natural resource and diverse cultures of its people in here. So many peoples in here from Nias, and then Sibolga, and then Karonis, Batanis, and others, Malay, of course, this is Malay, and Minang, yeah, Dr. Suhainizam is make a pantun like a Minang people, yeah. Difference in socio-economic and political identity are inherent characteristic of the people in North Sumatra. Now, how about the COVID in North Sumatra? The case in COVID in Sumatra has a significant progress step where we found at 14 July 2021, we have more than 800 cases, and it increased by a week in 77.4%. And we get the highest in 28 July to 2021 with the case, and increase again in a week, just in a week, we have get the cases in 2036. And we can see the population in here because the increase of the COVID cases in here because the low awareness of the community in comply with health protocol triggers and increase in cases. It's ironic because there are still many people who celebrate weddings, maybe gatherings, recitation, and come to be the takziah, yeah, mungkin we can say like that. Increased number of in Medan or in Sumatra makes the governor more seriously and concerned to prevent this with tightening of treaty, yeah, require health protocol and impose restriction by implementing PPKM. PPKM, we cannot do like another country like lockdown because something, so many variable that we have can talk in here, but we can make the restriction with PPKM. Okay, now we talk about the community engagement. What is the community engagement? Community engagement is same like the community or social or civil participation. So so in here, the key word is about the participation, of course, about the community participation. It is a process which individuals take part in decision making in the institution or in some programs or environment that affect them. And inactive voluntary involvement of individuals and groups is changing problematic condition in communities and influencing the policies and programs that affect the quality of their life and their life of other residents. This is about the community engagement and the participation in here. To reach the effective community engagement, of course, we have to do something and have the same vision in here. So to build the engagement in here, we have to listen another or understanding to each other so we get the good communication to reach our purpose or our objective to solve some like the prevention in infection of COVID-19. So when we talk or when we join with another people or we're together with our worker or anything, we will find about the wants, about the needs of somebody and how they are make a decision. And three part of this will bring the participation of community to engage. And then it means some community in here will be to be an agent, yeah, an agent into or to solve some anything about how to prevent the COVID-19 infection. That is about community engagement. And in Sumatra, of course, in Medan, yeah, we have so many found the participation or community engagement that have doing by the people in Sumatra, like, and we can divide it into 5. And the first is about self-medication. So the people in Sumatra always very clever, I think, make some herbal medicine. So they always drink the herb or maybe drink the milk like soya milk or eat the herbal supplement and infused water and etc. It is just for bring and build their self-medication to protect and to increase their immunization, yeah, body immunization, sorry, body immunology, yeah. Sorry. And the second one is about self-prevention. Yeah, community in Sumatra also make something activity to prevent their from COVID spreading or COVID exposure, like doing vitamin consumption or maybe sunbath and stay at home, get isolation to reduce the exposure from the environment. and then provide COVID prevention and tools equipment to maybe there is to be the early where they are find the little symptom of COVID, and body protect, exercise like going to bike, yeah, and doing their personal hygiene in daily. It's about their self-prevention and the action that engage in people of Sumatra is they are make some self-regulation. In here they are with their own they doing their health protocol in the best, and then going join with vaccination or maybe with follow the government doing the PPKM and then doing rapid test swab and or screening their apa ya their rapid test and swab to know early diagnosis about their health, and always increase in treaty program is about the testing, tracing, and treatment in Sumatra is always doing, although it is still weak, but it's always doing in continuously. And a special thing in Sumatra is brings very the solidarity of the people, yeah, of Sumatra. So we can say it's the part of the social caring. They are care about the COVID patient. So they are build the COVID care post, or maybe they are doing food donation and social assistance for the COVID exposure or COVID patient in here. So there is the solidarity in here seem very stronger. And along with the implementation of restriction on the community activities to stem the behavior of corona infection, many people also lose the opportunity to make a living. Initiative to donate is getting stronger, starting from raising donation to buy vitamin and supplement for health workers, making private home a place of self-isolation for positive patient without symptom, and providing free food for those who are forced or work outside at home. Like here, it is a herb worker, and then ini ya mungkin in Indonesia call it tukang becak, yeah. It is a transport station that always going out of home, work outside, and very possible that going the COVID exposure. And the last of engagement in Sumatra is doing by health promotion, where we make some banner or maybe some media that promotion about the COVID health advice, and giving the education for the family or the community anytime. Yeah, we call like the COVID education, and make some area, yeah, like special area like masjid. We can promote how to use the masker, and then the complex, yeah, a home complex, resident complex, always giving some message that how to prevent and promote about the COVID-19 program prevention. Sorry. So when we talk about the COVID, so many in here, I will tell you about some survey, the impact of social demographic COVID-19 in Sumatra. About the case of social distancing, we have found where is the people have the knowledge of social distancing policy in good, yeah, 18.7%, but that social distancing is implemented just into 72%. And because the pandemic of COVID, the transportation usage is decreased because some people always avoiding the use of the public transportation and online transportation. And the impact that very feeling by the people is about the work termination, where because the pandemic, some companies are closed during pandemic, and 2.52% workers are laid off. In other hand, more manufacturer or versus service company get the work from home policy in early. The manufacturer in 39 and in the service company is 42.36%. And some companies and service company doing the work from home and work on office, whereas the manufacturer just 34.76% and the service company in 41.75%. But we still found there are some people in here still just work in their office, and it is just getting rich in 7.07%. And 46.4% the people in Sumatra impossible doing the work from home, so they are still potential the exposure by the COVID-19 from the environmental or maybe nearby with their worker bases. And the high impact because the COVID-19 it's about the economic income. Of course, the people with low income people is getting decreasing of their income in 70.53%. And the transportation or warehouse in here get a low income also in 62.60%. Accommodation and food and drink business in 17.6 and 8.4%. And beside this, the expenditure increase in 56%. It's very, very terrible. Very makes some people in here lose about their power to live and is confused how to do to solve their problem in their house or their family. And the data said from the survey always about the frequently of people wash their hand is more doing by women, yeah, in 84% than the man, yeah, 75%. So it is a good awareness about how always to wash their hand, and then of course also to how to using the masker if they are going to outside, and choose the effective choosing to stay at home for self-isolation to reduce and to reduce the exposure of COVID-19. This is some survey that we have know about the Sumatra, and then communities concerned in here bring the people in Sumatra going to the mental health also. Yeah, and this is the data you can see where they are in 50 till 80 have the worried about the COVID-19 spreading or exposure that comes from media announcements. So in here, the people get the information about the COVID, and they are very worried about the effect, but they are confused how to do the prevention by themselves. And then about their self-health and family health, so it is makes some worries from the individual or family how to protect themselves and to reduce the exposure from COVID. And then the worries when go outside, this is the feeling that communities feel in Sumatra, and bring to make somebody using the masker. And you know, in the period of June to 2021, there has been a pandemic fatigue in here. So the endless pandemic has left most people exhausted so much that they don't care about the risk and consequence of their action. Society in here has reached herd stupidity, not leading to herd immunity. And the spike in COVID cases does not only occur due to the character of the virus, but also about the human behavior in here. For example, the behavior is come from officials who underestimate the pandemic and people who ignore the health protocol. Even today, there are still many people who question whether from COVID-19 really exists, or is it just information on television? There is a question that always pass at their brain. And at the first, people who obey the health protocol were loud and ridiculed while they were using the mask. Over time, because of the frequent sound of ambulance sirens near their home, and people began to comply with wearing masks. However, there are still many who deny that argument, and social media and sarcasm are unavoidable. And the pandemic that has been going on for more than 18 months, it has exhausted the people. This triggers people to be resigned and indifferent to the process. Based on the research, the COVID-19 task force in September until December 2020, the percentage of people complaints with wearing masks fell just in 28%. The infection, of course, in here, this pandemic fatigue occurs as a response arising from a prolonged public health crisis. And the severity of the scale of the COVID-19 pandemic has made all governments around the world call for the implementation in passive level. Besides that, there are other factors that make someone ignore about the process, and the opportunity to make a living other than having to go outside have a greater chance of getting tired quickly and experiencing symptoms of pandemic fatigue. Not only public health workers are also tired in here, maybe because they are very tired to save some patient of COVID, but sometimes the emotion and death of health worker also escalate. Disobedience to the health protocol has overwhelmed the health workers in dealing with the shortage in patient. And contrast with the community are not avoided, such as feeling that only patient must be served but do not care about the health worker. There are still families of patients who think that a patient is deliberately said to be COVID, or in other hand, officers are tired or fighting to save the patient life and anything. So the pandemic fatigue is found also in Sumatera, Medan. But about the vaccination in here, at the first, the people in Sumatra very scared where they are asking to be getting the vaccination. But now people not want vaccine because of need. There are rules that require showing a vaccine certificate when using the traveling or working. So this coercive thing is quite effective in getting rid of worries and for the sake of the continuity of work and needs on daily life. There is talk about how the engagement in Sumatra. So, and from that explanation, we can conclude some determinant that influence the community engagement in here. In fact, from all of this explanation, it's also necessary to pay attention to several factors that greatly affect the success of community participation in undergoing into intervention program. And from the meta-analysis that we found, there is six major variables that influence the community engagement. And the first is about the sense of community. What is the sense of community? Sense of community plays a role in promoting social action and citizen commitment. It is defined as a catalyst for participation and community development, associated with the variety of community engagement behavior. So in here, the sense of community is the first time as a catalyst that we have found, and we can move them to build the community engagement. And the second one is about the community identity. Identity in here implies about the psychological orientation to one's community that's more simple and individualistic. So in here, sense of the personal involvement. And it is correlated with the perceived community engagement in here. Perceived community engagement in here is very comprehensive. So we have to define the perceived and bring them to be a good understanding about the COVID prevention, of course. And the third part or variable that influence the community engagement is about the social well-being. The opportunities for participation and self-determination and possibility of contributing to community life are fundamental for increasing psychological and social well-being and sense of belonging. So the social well-being, it's a relationship between participation and sense of the community, like life satisfaction, loneliness, or others that always to be our based to the needs and wants of the people and how they are to be belonging and going to life in any time and in long time. And the fourth variables that influence the community engagement is about the place identity. It is some important also because Sumatra has a very variance of character. And when we talk about the place identity, is strong relationship between seniors and their neighborhoods as a source of social identity. So there is a part of our identity is given because being a citizen of my city, this is my country, this is my city, it will motivate the community to actively take care of their health, of course, their health or their community health. Yeah. And then the last but not least, there is the variable that important to understanding how to build the community engagement is about the trust. Of course, about the trust in the community and the trust in institution. And here, the citizen participation can only be developed based on mutual trust and between people and institution. And then community engagement in here, about trust in the community and trust in institution, it have a relation even though often controversial. But in community engagement could develop the opposite reason. So people engage because they do not longer trust their institution, perhaps using form or of protest and anti-established participation. So if we talk about this variable or this determinant, it is impossible to discuss participation or engagement without including the construct of empowerment, an active process where individuals, organizations, and communities can act to shape the environments they inhabit, to gain control their life, and to work for social justice. Six of the minor variable is very and we can found because this is always happen in when we are get the community empowerment or community engagement. And of course, the first variable that we have concern in here is about how is the sense of community. So anything intervention we have to, if the sense of community is low, so yeah, we just going find like just a poor management to solve the COVID-19 problem, and we have to change anything to how to define and found the answer or the solution and action, the strategy to bring the community come and think about how to prevent the COVID-19 in good or in well. I think that is my talks today, and I give it back to Mr. Dr. Swasnija. Thank you for your attention in here. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you, Dr. Ika, for a very interesting talk. I think a similar situation is being faced here in Malaysia as well, and in many other countries around the world who are battling the COVID-19 pandemic. Okay, so I think we have time for a few questions. If any of the members who are here today would like to ask Dr. Ika any question.
Salam, Doctor. Boleh tanya?
Please introduce yourself, where you're from, and the question, please.
Thank you. Makasih Dr. Ika. Nama saya Khair Hafiz dari UPM. teman saya bilang, you ngomong aja bahasa Indonesia. Kemarin saya tu kuliah di UNPAD Bandung, angkatan 2006. But anyway, it's interesting lecture there regarding social engagement in Sumatera Utara. But I have several curiosity to ask. First of all, regarding self-prevention and also self-medication. So I can see that they are actually have some self-medication, taking vitamins, milk, and some other things, and also self-prevention, which is sunbathing. So my question is, how much the government of Indonesia emphasize on the evidence base of the prevention and treatment? Because in Malaysia, when we talk about evidence base, when they are self-treated themselves, and because of that, we can see that people coming to the hospital late, and because of that, they are already in category 4 or 5, and we are actually late in treating the patient. So self-treating without evidence base for us is not really encouraging in Malaysia, but I can see here people are actually being accepted when they are actually self-treating and self-prevention using that method. The second one is regarding this online transportation. I'm not quite clear what is the meaning of the online transportation that have been mentioned before. Thank you.
Okay. Okay, directly, Mr. Suhainizam.
Yes,
Yeah.
please go ahead. Yeah.
Okay, thank you, Miss Hairil, yeah. For the question about the self-medication. Yeah, in Indonesia, maybe I can say in 70 until 90% knowing about the herbal medication or self-medication, because we are known from our parents or maybe from our grandfather or grandmother, yeah, and they are always educate, always using some herbal medicine, and it is like apa bahasa Indonesia, warisan ya, budaya, culture in people in Indonesia. Making the self-medication is about the traditional medicine is a part of the people or community in Indonesia. They have the belief in there. They believe that the herbal or self-medication is, yeah, maybe in medical it's not 100% as a treatment, but it is can reduce some symptom or some symptom, or maybe some diagnosis, or maybe some feeling sickness or complaint in their body, and we know all the vitamin or maybe the medicine is also produced by using the resource, about using the natural resource like the herbal resource, like some leaf or maybe some pepper or maybe the garlic or maybe tomatoes, yeah, anything just produced by themselves and make some, what we said it, some mixing of herbal that they believe it will bring it will protect themselves and make it clearly, yeah. So we can, and it's happened because they are also afraid to be going to the hospital. They are afraid of going to the doctor. They are afraid about why I didn't want to injection in here, because in people mindset, injection is identical the hospital treatment in here. So they choose how to use or eat or drink the herbal medication to get their self-medication in here. In Bandung, maybe if you have found it in Unpad, Javanese is the member or the people that have the culture always drink the herb, yeah, because they are believe it is usually it is like a tea maybe or like a coffee, but there have the component that can increase their immunity in here. And about the transportation in here, but no transportation, sorry, well, what your question? Maybe you can explain it more, your question about transportation.
I just wanted to know the term, the use of term of online transportation. What is that? Is it Grab?
Oh, see, the online transportation. In Indonesia, we have online transportation from our ministry. We call that Gojek, yeah. Gojek and Grab. Maybe in Malaysia there is
Oh,
Grab.
okay.
Grab is like online transportation.
Oh, okay. Thank you.
That is, yeah. Okay, Miss Hairil. Thank you for your question.
All right, thank you, Dr. Ika, for the explanation. I think it's very relevant. Okay, we have one question on the chat box. It is a two-part question. If Dr. Ika can respond to this. Number one, how to get the interest of the community to participate in community engagement. And the second one is how to ensure that when you have the community engagement, it is sustained.
Okay, thank you very much for Ms. Nurliza. It is a good question, yeah. How to get their interest to participate. Of course, it is the question for all community engagement or all community empowerment. Back to our determinant, Ms. Nurliza, how to get their interest. So we have get a click and found the sense of community. That is the catalyst of this empowerment on this engagement, because there is a catalyst. And when we have joined to the community and found their sense to educate them or make some vision, the same vision and mission. Yeah. So the people in Indonesia believe and trust and want to try to join in our intervention, of course. So the sense of community is the point important in here. And how to get there, well, also, of course, we have to giving some approach and getting the best communication and bring some relationship, a good relationship with the community. That is the first step to get their interest. And also, of course, we talk about our intervention in here. So we have to, the intervention we have said to them and communicate with them in interest, experience, or maybe like a simple, just a simple. It has to simple communication and information that giving to the community, because you know there is the different and variant of education of the people. So we cannot doing some maybe like in our school, like theoretical communication is not better doing in here, but we have found the key of our theory and giving to them, educated to them, so they understand about our opinion or our intervention, so they will be interested. So we have to find the sense of the community in here. That is the first. Yeah. Also, how to ensure there to be sustained. It is maybe just build the capacity building or the person building in here. We have to always elaborate, always communication, always get the collaboration in some activity, and don't leave them. Yeah, sometimes when we have the intervention, after we doing our intervention, so we are gone. That is the community they are not believe again with us, now trust with us. So it is just your need. You not talk about me. You just say in your mouth. That is you have to avoid that. So we have always keep communication, keep contact. Yeah, keep contact with them and always giving atau build their sense. Always has a good relation. Then don't leave them. That is the key point. Don't leave them after you have passed your intervention, because the intervention will be sustained if you always continuously with them also. Thank you. Yeah, nice question, Mr.
Thank you, Dr. Ika. There's another question on the chat box. There are two more questions. All right. So if you want to fill those questions, the first one from Dr. Kalsom, if you can share some insights related to the community support and engagement towards COVID-19 vaccination.
Oh, insight related to the community support and engagement toward the COVID vaccination. Maybe I couldn't show you about the picture or some video about this, but I can say how how the vaccination in Indonesia. Yeah, I have told you that Sumatra is the unique person, unique people with a various character. But in Sumatra, how they are insight and support about the vaccination because the in Malay paksaan, sedikit paksa. Tapi bukan banyak ya, sedikit paksa. I mean the people or the community needs to work, needs to going their life belonging, needs to earn their money to live with their family. So the economic status is the first variable or the first factor that some people in Indonesia or in Medan, Sumatra, they're getting vaccination because their needs and wants. Yeah, their needs, that is different from at the first they are scared, but because the government giving the example like Jokowi at the first time going vaccination, or maybe in Sumatra, governor make the first time vaccination. So that it's built the community trust that is vaccination is safe. So, and then there needs to work and the rule and regulation that the people have to show the letter of vaccination. That is satu paksaan tadi ya, from because the letter. So mau tak mau kata Indonesia ya, mau tak mau saya vaksin gitu, because they need to work, they need to live. Yeah, there is some community support, but actually because in Sumatra always learn by their partners. Yeah, if their partners is safe in vaccination, so they want to do vaccination too. So it is a communication with another partners or the neighbors or the family. It will be built the mindset of the people of community to vaccination in here. Yeah, I think that is Mrs. Kalsum. Thank you for your question.
All right, thank you, Dr. Ika. So we go to the last question for the first part of the session, from Muhammad Ikhwan. Does Indonesia government provide financial support to community empowerment program? If yes, how much? And what are the mechanisms to supply the financial fund?
Wow. Wow. Maybe Mr. Muhammad will be a leader in government in here, yeah? Actually, I have said to you, Indonesia government provide in here, in 1 year of COVID spreading today, maybe we can just count in here in this just 1 year, yeah? But we always hope that the COVID-19 is finished immediately, yeah. And Indonesia government provide the financial support in here, support to community. Maybe not about the empowerment program, yeah, because that is very complex program. It's maybe in one, we can say it is just one prevention program, yeah, not just empowerment. We cannot divide it just about the community empowerment, but the program is the name or the title is it is about the prevention of COVID-19 infection. So some was part of the prevention in here, maybe including the community empowerment. So the financial in here, yeah, has provided by the government. About the how much, yeah, how much, so I think it is secret, yeah, but not similarly with another country. We can see from the GNP on growth of income from a country. It is not same with Malaysia, with Indonesia, and I think I am not, I cannot say in amount because it is very, very sensitive, yeah, if I have told this. We have to know that because there is a government policy, yeah, of course. And what are the mechanisms to supply that is? That is simple. Yeah, in Indonesia or in our presentation before, I have told some promotion in the resident environment. The people make some we call name is Posko Peduli COVID-19. Yeah, that is Posko. That is one place. So in any environment has the Posko. So anything about the COVID-19, by like cases or maybe just symptom or just OTG in Indonesian ini. So they will be informed, yeah, in be informed, and that is will be compilated by Gugus Kendali COVID-19 in Sumatera. So there is the person, the power empowerment also about how to treat, how to testing, treat, and tracer about the COVID-19 cases. So the mechanism to supply the financial funds is just very simple, because if we have funds in this is the COVID-19 patient maybe, so it will be free in anything service in health, and they have free until from they are from hospital until they maybe die and going to back to their God, yeah, and that is just free. That is mean the government provide the financial support in here. And about the masker sometimes and some health protocols and others. Yeah, so Sumatra very serious and concerned about this prevention. I think that's all, Mr. Thank you.
Okay, thank you, Dr. Ika, for I think we'll stop taking questions because we still have another speaker. So thank you, Dr. Ika, for your excellent presentation and also for answering the queries that we received from the members of the audience. So maybe we can take a 5-minute break before we proceed with the second presentation. Just as a reminder, I've posted again the link to the attendance form for today's event. So for any of the participants who have not filled in the form, kindly do so during the 5-minute break so that we can get your particulars and the number for this event. Okay, thank you very much. We'll see you again in 5 minutes.
Okay.
Okay, hi again. Hopefully everybody has benefited from the short break in between the sessions. Now we'll continue with the second speaker, building on some of the effects that Dr. Ika has quoted from the prolonged COVID-19 pandemic. Healthcare workers are getting exhausted. The people are also getting tired and sick of having to adhere to the protocols and the SOPs for COVID-19 prevention. And a lot of them are having pandemic fatigue, and that has an effect on their mental health status. So for the second presentation, um, it is a coincidence, I think, that our second presenter is an alumnus of Universitas Sumatera Utara. Okay, Dr. Jacinta is currently doing her doctor in public health. She graduated from USU in 2012. After that, she completed her housemanship in Hospital Tunku Fauziah Perlis, and subsequently served in Klinik Kesihatan Batu Kawah, Kuching, and also Klinik Kesihatan Kuala Pilah in Negeri Sembilan before joining our program here in UPM. Currently, she is in her second year of DRPH and doing her residency attachment in Pejabat Kesihatan Daerah Larut Matang dan Selama, Perak. She'll be talking on the impact of COVID-19 pandemic on mental health in Malaysia. So, Jack, whenever you're ready, you may start. The floor is yours.
Hello and a very good evening to everyone. I'm Jacinta and I would like to share a little bit on the impact of COVID-19 pandemic on mental health in Malaysia. Before I carry on, I would like to introduce a little bit about myself. I attained my medical degree from Universitas Sumatera Utara in 2012. I completed my housemanship in Hospital Tuanku Fauziah in Perlis and subsequently served in Klinik Kesihatan Batu Kawah, Kuching and Klinik Kesihatan Kuala Pilah, Negeri Sembilan before joining the DRPH program in UPM. Currently, I'm in my second year of DRPH and doing my residency attachment in Pejabat Kesihatan Larut Matang dan Selama, Perak. This is the overview of my presentation. We start off by the inequalities in mental health until when to seek professional help, support, and consultation. We start off with the inequalities in mental health. How a person responds to the crisis or disaster is influenced by individual background, the differences compared to others, and the community they live in. If we look at the image, let's just assume many of us are in this blue speedboat over here with a job security, government jobs. We have food on our table, a roof on our heads. But that's not the case with the other half of the population. And we assume they are in this tiny yellow sampan, just trying to stay afloat, or perhaps already capsized or drowning. So these are the retrenched employees. They have mortgages to pay with no source of income, counting every penny they have to provide their child with a decent meal and to repair that leaking roof. So yes, we are all facing the same storm, which is COVID-19, but we all are in different boats, each with different challenges and circumstances, and hence the inequalities on mental health. The more difficult your circumstances, the more likely it is that you will experience mental health problems. Those who face the greatest disadvantages in life also face the greatest risk to their mental health. The definition of mental health itself is a state of well-being in which an individual realizes his or her own abilities, they can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps to determine how we handle stress, relate to others, and make choices. COVID distress might look differently to each one of us. There is a worry of possibility that our family members are infected, your opa, parents, little ones. There is fear of falling ill and dying and losing loved ones. There is also feeling helplessness, not able to protect loved ones. Once anyone is in the quarantine center, you feel helpless. You are not allowed to visit or do anything in person. The stress, anxiety, especially due to separation because of being quarantined. The fear of being placed under home surveillance because of the disease, and avoiding health facilities due to fear of becoming infected while in care. I have come across children who are not keen to send their elderly parents to be admitted, as the rumors were if anyone who goes in never comes back alive. And there's also the feeling of helplessness, boredom, loneliness, and depression due to feeling isolated. I have also come across cases where once they return home from overseas and requiring them to quarantine at the hotel. For example, in my case, a 5-star hotel. Even with all the comfort, he still threatened to commit suicide if he was not let out of this room. So here are some examples on how COVID distress might look like. How is it the situation in Malaysia? Malaysians' mental health are at a worrisome stage, and more Malaysians are ending their life. This is also true among healthcare workers, where it is noted there is a high level of depression, anxiety, and burnout among frontliners. If you look at the trend over here, the suicide rates increasing from 2019 all the way to 2021. And in the year 2021, the number of suicide has increased more than half than the previous year. This value here is the rates up to May 2021. And the main causes of suicide in 2021 are family problems, finances, and emotional pressure. Some of the methods used in ending their lives are hanging, poisoning with pesticides, jumping off a tall building, or poisoning by car exhaust fumes. Sadly, looking at the statistics, there is at least 2 Malaysians taking away their own lives each day, meaning even today there's 2 which took their own life. And women are 5 times more at risk at ending their lives, and more than half involving youth of 15 to 18 years old, followed by those in their 19 to 40-year-old. According to Khazanah Research Institute's study, the Malaysian workforce, a changing landscape, nearly 30% of the employed women in Malaysia are sales and service workers. And this industry is among the worst hit by the pandemic now, seeing among the highest retrenchment rates and salary cuts according to other labor reports. Women are also at higher risk of suffering from domestic violence and sexual assault, crimes which has been seen rise in the cases since the first movement control order was implemented in March 2000 last year. The impact of the pandemic on the workforce itself has seen that Malaysians are reported to have the highest level of anxiety compared to 28 other countries. The categories looked into were agitation of employment situation, agitation, the stress due to changes in work routines, and pressure from the family. These studies were conducted among the public in Malaysia after the pandemic, and MCO, which shows there is a significant increase in depression, anxiety, and stress symptoms. So when does worry become a problem? A normal worry would actually help you get what you want, and it solves problems in your life. It's excessive when it leaves you feel demoralized, upset, or exhausted. It gets in the way of living the life you wanted to lead. And if you look at the image here, just on a daily basis, we have a certain amount of stress in ourselves. So as the days goes on, this additional stress, and it increases the level of stress. So what happens if we do not cope with the stress well? So there's avoidance of underlying concerns, prolonged distress, short-term gain, longer-term pain, and worsening of initial symptoms. Okay, so when there's excessive stress and you add on a little more to that, what happens? The bucket overflows. This is when you have your panic attacks, you try to hurt yourself or other people, you fall ill, you become restless or depressed. And how do you deal with it? So this is how exactly you deal with it. You make holes. Holes in this manner would be how the coping strategies you use to manage your stress, to be in a manageable condition. And how do you do that? Because each individual nature of coping is different. One size doesn't fit all, and we can't hand out a comprehensive coping manual and tell everyone to have at it. So here are a few of the coping strategies you can consider. Generally, take care of your physical health, maintain social connections, take a break. A break could be a simple one like making a hot Milo and just looking at the rain. And you keep a routine, spend time outside if it's permissible, and reach out for help when it's needed. Other strategies include practice self and other compassion. You have to recognize and accept that vulnerability and suffering are inevitable and part of the human experience for all of us. Secondly, limit social media and news consumption. Well, stay informed, but not to be flooded or overwhelmed. There's tons and tons of rumors and stories going around from every corner of the social media. So pick reliable sources and read. Stay informed but not flooded with all the excessive information. And lastly, sustain social and relational connection. Social distancing involves physical distancing, but it's not a relational or emotional distancing. So you still connect with your loved ones with the social media, internet. So here are the few things you can control. These are within this circle over here. Your positive attitude, how I follow CDC recommendations, my own social distancing, my kindness and grace, limiting my social media, turning off the news when it's not needed, finding fun things to do at home. So you and me will focus on these things. Anything outside this circle is something beyond your control. So it starts off from the amount of toilet paper at the store, how long will this last, how others react, other people's motives, predicting what will happen, the action of others if others follow the rules of social distancing. So according to the philosopher Lao-Tzu, if you are depressed, you are living in the past. If you are anxious, you are living in the future. And if you are at peace, you are living in the present. So here are some recommended mindfulness resources, the best meditation apps for this year. You can check out some of the apps, and it's pretty insightful and helpful. And here are the messages to the general public. Do not refer to people with diseases as COVID-19 cases, victims, COVID-19 families, or the disease. They are people who have COVID-19, people who are being treated for COVID-19, or people who are recovering from COVID-19. And after recovering from COVID-19, their lives will go on with their jobs, families, and loved ones. Secondly, minimize watching, reading, or listening to news that cause you to feel anxious or distressed. Seek information only from trusted sources and mainly in order to take practical steps to prepare your plans and protect yourself and loved ones. Seek information updates at specific times during the day, once or twice a day. Do not bombard yourself with all the unnecessary rumors. Also, check in by phone on neighbors or people in your community who may need some extra assistance. Working together as one community can help to create solidarity in addressing COVID-19 together. Some messages to healthcare workers. For healthcare workers, feeling under pressure is likely experience for you and many of your colleagues. It is quite normal to be feeling this way in this current situation. Stress and the feelings associated with it are by no means a reflection that you cannot do your job or that you are weak. This is a unique and unprecedented scenario for all of us. Even so, using strategies that have worked for you in the past to manage times of stress can benefit you now. You are most likely to know how to be stressed, and you should not be hesitant in keeping yourself psychologically well. This is not a sprint, it's a marathon. Some healthcare workers may unfortunately experience avoidance by their family or community due to stigma or fear. This can make an already challenging situation far more difficult. And as far as possible, stay connected with your loved ones. Digital methods are one means of maintaining contact. Moving on, messages to older adults and their carers. Older adults, especially in isolation, and those with cognitive decline dementia may become anxious, angry, stressed, agitated, and withdrawn during outbreak or while in quarantine. It may also be helpful for information to be displayed in writing or pictures. Engage their family and other support networks in providing information and helping them to practice prevention measures like hand washing. Make sure that you have up to 2 weeks supply of all the regular medicines that you may require. Keep to regular routines and schedule as much as possible and help create new ones in a new environment, including regular exercising, cleaning, daily chores, singing, painting, or any other activities. Messages to team leaders and managers. Be sure to to keep in mind that the current situation will not go away overnight, and that you should focus on longer-term occupational capacity rather than repeated short-term crisis responses. Partner inexperienced workers with more experienced colleagues. The buddy system helps to provide support, monitor stress, and reinforce safety procedures. Ensure that outreach personnel enter the community in pairs, initiate, encourage, and monitor work breaks. Managers and team leaders are also facing similar stresses as their staff, with potential additional pressures in the level of responsibility of their roles. It is important that the above provisions and strategies are in place for both workers and managers, and that managers can be a role model for self-care strategies to mitigate stress. And messages to people in isolation or quarantine. I guess this message is for myself. Recently, some of my colleagues in my pejabat kesihatan has been is positive of COVID-19, and some of us are close contacts and have to be quarantined, and swab was taken. So I'm still waiting for my results, and there are some, I guess, concerns as I'm pregnant at 36 weeks with my first child. So yeah, this message is for me as well. So I'm trying to keep as much as possible my personal and daily routines and create new ones. So as for now, I'm doing a pre-recorded version of my CME. And for the others out there who are in quarantine or isolation, do engage in healthy activities that you enjoy and find relaxing. And if you could exercise in your room, please do continue to exercise and eat healthy food. And do socially be connected via email, social media, video conferencing, and telephone. And use the IT to connect with your loved ones. And messages for moving on to messages to parents for positive parenting during the COVID-19 pandemic with your children. So you reassure them, stick to the facts, and let them know that you will keep them safe and be there for them. You empower them. They have the opportunity to learn values of caring for others and thinking about the community. Maintain your own calm. Well, if a parent is calm, the children tend to follow their attitude. And engage them. This is the time to spend quality time with your family members. And I guess for some of you guys, this quality time has stretched from 1 year to 2 years. But let's make the best out of it. Try to manage their emotions, give them opportunity to ask questions, discuss their feelings about the pandemic and how it affects them. Also, beware of how much time they're spending on social media. So filter and limit whatever is being accessed via internet, and educate them. This could be the opportunity to educate them on good habits like hand washing and routines. Try to practice as much normally possibly can, as much normally as possible. And these are some examples of play activities for children during quarantine and movement control order. Online resources, YouTube channels, and some free learning websites. As I don't have a child of my own right now, neither do I have any nieces or nephews. So here are some activities done by my colleagues in UPM while they are working in pejabat kesihatan and pursuing their studies at the same time. So this is Farah's house. Using the kids are using the swimming pool, so as the same as Tariq's children and Shera's children in their swimming pools. This is Farida having an outdoor picnic in their house. Same goes with Fikri's children having an outdoor picnic. And this is an river bathing session, I assume, near Huzaifa's house. And these are Zah's children. They made their own cakes and decorated them, and some batik painting, and this Becca's child who's making chapati. So this is how they get their children involved in activities during pandemic. And you feel stressful, think of this stop. So you stop doing whatever it is you are doing. Just be in the moment. Take a breath or take three deep breaths, and you observe everything around you. Be mindful, feel, use all your senses, touch, hear, and then you proceed with your work. So in terms of work-life balance, the key word is priority. So you have to list down the things you need to do in a day, in a week, and you make compartments of it. So you place them under different categories. Is it urgent or non-urgent? Is it important or not important? And you go on from there. So those which are urgent and important, you do it right away. Not urgent but important, plan to do it as soon as possible. And activities which are urgent but not important, you delegate, you outsource. And those which are not urgent and not important, just dump it all together or postpone it. And moving on to Malaysian government's response to COVID-19 in terms of financial aid and hotline services which is provided. I realized there's tons of financial aid by the government itself, from electricity bill discounts to free internet to other aids as seen here. And some of the hotlines provided, the Hotline Crisis Preparedness and Response Center, Talian Kasih 15999, Talian Hotline Sokongan Psychosocial Women's Aid Organisation, Lifeline Association Malaysia. And next we have the other initiative by NGOs. This is by Mercy Malaysia COVID-19 Pandemic Fund and Hotline. They conduct vaccination outreach programs in the aim of helping homeless individuals, people with disabilities, and anyone whose health problems prevent them from going to the vaccination centers. They also prepare psychological and social services, support services to Malaysians during this COVID-19 pandemic. As for 7-Eleven Malaysia, they started a campaign, Lend a Helping Hand 2021. Anyone can purchase general essentials like cleaning products, instant noodles, medication at 7-Eleven stores nationwide and leave them at their designated collection boxes. So it will be distributed to beneficiaries closest to respective stores, including government hospitals, medical clinics, other civil service frontliners, charity homes for the elderly and children, public universities, and students' dormitories. Moving on to the NGOs Hubs Emergency Fund for NGOs. This is to support orphanages, old folks home, refugee shelters, and other NGOs who are struggling financially due to the national lockdown. Yayasan Food Bank redistributes surplus food from manufacturers, wholesalers, hypermarkets, and hotel industry to B40 communities in higher learning institutions, charity homes, welfare centers, and program Perumahan Rakyat Termiskin through its partners. Refuge for Refugees supports the plight of refugees in Malaysia, including providing food and medical aid, education opportunities, as well as organizing fundraisers. The Lost Food Project rescues and gives aid to those in need, including charity partners, B40 families, refugees, and vulnerable communities. The Kinshara Soup Kitchen initiates numerous fundraisers to provide skill sets training for low-income individuals to gain independence on top of its usual soup kitchen and food bank operations. As for the Food Aid Foundation, they rescue surplus food and distribute it to charity or welfare homes throughout Malaysia. And in recent months, they have distributed thousands of food bags to quarantine centers and vaccination centers to support frontliners that are serving the public during these trying times, while also distributing groceries and supplies to underserved communities. As for South Malaysia, Ramadan with Shell, they aim to help small medium enterprises sell their delicacies as Shell stations. This campaign allows local and small-time food vendors by providing them an avenue to market their Ramadan food goods during this difficult period. As for HP Malaysia and Tech for Malaysia, I Move with HP campaign. Schools in Klang Valley with high population of underprivileged students will be identified by Teach for Malaysia team, and families who are nominated will be receiving HP 14 laptops. Sunway malls are rent-free during movement control order. The retailers that are now providing essential services and supplies, Sunway Mall has granted these retailers rent-free during the MCO order period. So this movement is by the people, for the people, Bendera Putih, where the mechanism of the movement is simple. If you are in need of food and essentials, just raise a white flag outside your home to signal to others and ask for assistance. It can be a plea for help instead of taking drastic actions that may hurt you or your loved ones. And this is actually activity done by Pejabat Kesihatan for the healthcare workers to reduce burnout among the staff. And next is when to seek professional help, support, and consultation. Is when there's persistent sadness, anxiety, anger, hopelessness, worthlessness, loss of interest in pleasurable activities, and of feelings of being overwhelmed, significant impairments of changes in functioning such as sleep, getting out of bed, appetite, concentration, and or hygiene, increased impulse, recklessness, or risky behaviors, or recurring thoughts of expressions about death, dying, and or suicide. And lastly, don't be afraid to ask for help. All you have to do is ask. Thank you.
All right, thank you, Jack. Hope you are feeling much better. So I think the situation is very similar all around the world. People are getting tired, the frontliners are getting exhausted, and that could give rise to a lot of mental health problems, as illustrated by Jack's presentation just now. So now I open the floor to any questions or any views that any of the members of the floor would like to ask Jack or to share with the rest of the participants. or you can also type it out on the chat box if you have any questions. Okay, so I think everybody is very clear on what was presented. So I think this is the time when we need to not only look out for ourselves, but also for the people around us, our family members, our community members. Yeah, as emphasized by Dr. Ikas and also Dr. Jacinta's presentations just now, we need to rely on the people around us, our family members, our friends, and also members of the community to help each other. Because this has been going on for a very long time and we have no idea when we will be free of this. So it is quite a long time to go. Okay, all right. Okay, we have one question from Dr. Zaid. With regards to social media use during COVID, as the MCO limits social interaction, people may shift to social media for their social needs. Then should we limit social media use as mentioned in your slide? Okay, so Jack, maybe you want to address that question?
Okay. So when should we limit the social media usage? So we can pick on when the right situation to limit when the usage of social media itself. So when I mean limit the usage of social media here is when it's listening to the news, the statistics and the rumors, the stories. That is the exact time for you to limit how much of news or rumors you want to listen to. So you pick a specific time, maybe a reliable source from KKM or MKN, WHO or CDC. Those are the sites you want to listen or hear from when it regards to statistics of COVID-19 and their progress of the cases. But you definitely should limit all those rumors, those circulating in social medias, in your WhatsApp, in your Telegrams and all. Those are the things you should limit. The other things you can carry on with, because you have to use social media for work purposes, for maybe some entertainment and things like that, yes. But even so, for entertainment, you should limit, like what kind of entertainment, how many hours or how long you want to spend watching a TV program on your TV. So those are things you should limit. But other things you can use for knowledge purposes, for your assignments, for your work purposes. Those are the times you can use it as much as you want. Is that clear, Zaid Azman? Okay,
All
you're
right.
welcome.
Thank you very much. Any other questions from anybody else, or you want to type it out on the chat box? All right, if there are no further questions, I would like to thank both our presenters for today, Dr. Ika from USU and also Dr. Jacinta from UPM. It has been a very informative session, I think. It concerns all of us because all of us are going through this pandemic and it affects us in many ways. So hopefully whatever was presented would be beneficial to everyone in facing this very long pandemic. Also, thank you to our counterparts in Universitas Sumatera Utara for joining and participating in our session today. And we look forward to future collaborations for other programs. Okay. With that, take care, everyone. Stay safe, stay healthy. Thank you very much. And Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh.